In the United States, 1 in 8 men will be diagnosed with prostate cancer during their lifetime. And most of those diagnoses, over 60%, happen after the age of 65. Yet despite how common it is, many men don't talk about it. They don't ask questions. They don't get screened. And tragically, that silence can become deadly. This video isn't meant to scare you. It's meant to wake you up. Because the truth is, prostate cancer is very treatable when caught early. But if ignored, it becomes one of the most lethal cancers a man can face. And the worst part? Most men have no idea they're at risk until it's too late. If you're a man over 60, or if you love someone who is, this might be the most important video you watch this year. Over the next few minutes, we're going to walk you through what prostate cancer actually is and why it's often missed, the warning signs most men ignore, the biggest risk factors, and why some men are more vulnerable than others, the truth about screening, when, how, and why it matters, and most importantly, what you can do right now to protect yourself or someone you care about. This isn't just a health issue, it's a life issue, a family issue, a legacy issue. Because when a man loses his health, it affects everything, from his independence, to his relationships, to the memories he's still meant to make. And that's why we made this video. So let's talk about what matters. Let's cut through the silence, and let's face this together. Let's start with the basics, because too many men hear the word prostate without truly understanding what it is or why it matters. The prostate is a small gland about the size of a walnut, located just below the bladder and in front of the rectum. Its main job? To help produce the fluid that nourishes and protects sperm. It's a part of the male reproductive system, and though small, it plays a crucial role. Now here's where it gets serious. Prostate cancer occurs when cells in the prostate begin to grow uncontrollably. Like most cancers, it starts silently. These abnormal cells divide and multiply, forming a tumor. In many cases, the growth is slow, so slow in fact that a man may live with it for years without knowing it's there. But not all prostate cancers are slow. Some are aggressive. They grow quickly. They spread beyond the prostate to nearby lymph nodes, bones, or other organs. And once that happens, treatment becomes far more complicated. The earlier it's caught, the better the outcome. Period. Here's a critical fact. Not all prostate cancers are the same. Some are low risk and may never cause serious harm. Others are high risk, fast-moving, and deadly if ignored. That's why screening and diagnosis are so important, because they help doctors determine not just if cancer is present, but what kind it is and how best to treat it. In 2024 alone, the American Cancer Society estimates nearly 299,000 new cases of prostate cancer will be diagnosed in the US. That makes it the most common cancer among American men, after skin cancer. And while survival rates are high when it's caught early, nearly 100% 5-year survival, that number drops dramatically if the cancer has spread beyond the prostate. Let that sink in. Caught early, almost every man survives. Caught late, the odds change fast. So how does it sneak by? Because in the beginning, prostate cancer doesn't cause pain. It doesn't come with loud, unmistakable signs. It comes with minor annoyances that men often shrug off. Waking up to urinate more than usual, a slower stream, trouble starting or stopping urination, a little discomfort. Small things. Easy to explain away. Easy to ignore. But here's the truth. By the time real symptoms show up, the cancer may already be advanced. And that's what makes it dangerous. Not just the disease itself, but how easily it hides in plain sight. That's why understanding the basics isn't enough. We have to listen to our bodies. We have to be proactive, not reactive. Because the prostate may be small, but when something goes wrong, the consequences can be massive. So now that we understand what prostate cancer is, the next question is even more important. What signs should you be looking for? Let's take a closer look at the symptoms, especially the ones most men brush off. Prostate cancer is known as the silent killer for a reason. In its early stages, it often presents no clear warning. But when it does begin to show, it whispers through subtle shifts in your daily routine, things you might not even notice until someone points them out. Here are the most common early symptoms that men over 60 should never ignore. Frequent urination, especially at night, a condition called nocturia, difficulty starting urination, a weak or interrupted stream, the feeling that your bladder is never fully empty, pain or burning during urination or ejaculation, blood in the urine or semen. Alone, these symptoms could mean something less serious like an enlarged prostate or urinary tract infection. But when they appear together, especially persistently, they could be warning signs of prostate cancer. But it doesn't stop there. When prostate cancer spreads, especially to the bones, which it commonly does in advanced stages, men may begin to experience pain in the hips, back, or pelvis, swelling in the legs or feet, unexplained weight loss or fatigue, loss of control over bladder or bowel functions. These aren't just signs of aging, they're red flags. They're your body's way of saying, pay attention, something isn't right. Here's the problem. Too many men wait until these late-stage symptoms appear before seeing a doctor. By that point, the cancer may have already spread, reducing treatment options and survival odds. And why do they wait? Because men are taught to tough it out. Because there's still a stigma around talking about prostate health. Because denial is easier than facing the possibility of cancer. But here's the truth. Silence doesn't protect you. Action does. Think about this. If you notice chest pain, you'd probably go to the hospital. If your vision suddenly blurred, you'd call a doctor. So why ignore the signs below the belt? Your prostate is just as vital to your long-term health and just as deserving of your attention. The earlier you act, the more options you have. In fact, when caught early, prostate cancer is one of the most treatable cancers there is. The symptoms may be subtle, but your response doesn't have to be. So now that you know what to watch for, let's talk about why some men are at greater risk than others. Not every man faces the same level of risk for prostate cancer. Understanding your personal risk can help you and your doctor make smarter choices about screening and prevention. Let's break down the key factors that influence your risk. 1. Age. The number one risk factor. The chance of developing prostate cancer rises as you get older. After age 50, your risk begins to climb significantly. For men over 60, the odds increase even more. In fact, the majority of prostate cancer cases are diagnosed in men aged 65 and older. Aging changes your body in many ways, including your prostate. Cells can start to mutate and grow abnormally. The older you get, the more time these changes have to occur. 2. Family history. Your genetic legacy matters. If your father, brother, or close male relatives had prostate cancer, your risk is higher. Studies show that having a first-degree relative with prostate cancer roughly doubles your risk. This genetic predisposition means you should be more vigilant, especially if multiple family members have been affected. Don't be afraid to ask about your family's health history. It could save your life. 3. Race and ethnicity, a critical factor. Research shows that African American men have the highest rates of prostate cancer in the US, and their cancers are often more aggressive. They are also more likely to die from the disease compared to men of other races. Why is this? The reasons are complex and include genetic, environmental, and socioeconomic factors. But it means awareness and early screening are even more important in this group. Before, diet and lifestyle. What you eat and how you live matters. While you can't change your age, race, or family history, diet and lifestyle are areas where you have control. Eating a diet high in red meat, processed foods, and unhealthy fats may increase risk. Conversely, diets rich in fruits, vegetables, and healthy fats like omega-3s can be protective. Exercise, maintaining a healthy weight, and avoiding smoking also lower your overall cancer risk. Number 5. Other medical conditions. Some studies suggest that men with certain conditions like obesity, diabetes, or inflammation of the prostate may have altered risks for prostate cancer. It's important to discuss your overall health with your doctor to understand how these factors might affect you. Screening means testing for prostate cancer before symptoms appear, to catch it early when treatment is most effective. The 2 main screening tools doctors use are PSA test, prostate-specific antigen, a blood test measuring the level of PSA, a protein produced by both normal and cancerous prostate cells. Elevated PSA levels can indicate prostate cancer, but can also be caused by other conditions like infections or an enlarged prostate. Digital rectal exam, DRE, a simple, quick physical exam where the doctor inserts a gloved finger into the rectum to feel the prostate for abnormalities such as lumps or hard areas. The guidelines vary somewhat among health organizations, but here's the general consensus for men over 60. If you're healthy and have a life expectancy of 10 years or more, screening is usually recommended because early detection can improve outcomes. If you have higher risk factors, family history, African American race, screening should start earlier and be done more frequently. If you have serious health issues or a shorter life expectancy, the benefits of screening may be limited, and the risks of invasive follow-up tests might outweigh the benefits. An elevated PSA doesn't automatically mean cancer. It can be caused by infections, inflammation, or benign enlargement. But it does mean your doctor will want to investigate further. This may include repeating the PSA test to confirm the results, a prostate biopsy, where small samples of prostate tissue are taken for analysis, advanced imaging tests like MRI to look for suspicious areas. Prostate cancer screening is not without debate. Some argue that routine screening can lead to overdiagnosis, detecting cancers that may never cause harm, and unnecessary treatments with side effects like impotence or incontinence. That's why it's important to have an open, honest conversation with your healthcare provider about the pros and cons of screening based on your personal risk and health status. Regular screening is your best chance to catch prostate cancer early. Don't wait for symptoms. Don't ignore your risk. If you're over 60, talk to your doctor today about getting a PSA test and digital rectal exam. Early detection saves lives. In the next section, we'll cover the treatment options available and how men can make decisions that fit their lives and values. When it comes to prostate cancer, knowing your treatment options is crucial. The good news? Many men diagnosed with prostate cancer have several paths available, depending on the stage and aggressiveness of their cancer, as well as their overall health and personal preferences. 1. Active surveillance, watchful waiting. For many men, especially those with slow-growing, low-risk prostate cancer, immediate treatment may not be necessary. Instead, doctors recommend active surveillance, carefully monitoring the cancer with regular PSA tests, exams, and sometimes biopsies. This approach helps avoid or delay the side effects of treatments like surgery or radiation, while keeping a close eye on any changes that might require action. Number 2. Surgery, radical prostatectomy. Surgery to remove the prostate gland can be an option for men with localized cancer. This procedure aims to remove all cancerous tissue and offers a chance for cure. While surgery can be highly effective, it carries risks such as urinary incontinence and erectile dysfunction. Recovery times vary, and discussing these potential side effects with your doctor is essential. 3. Radiation therapy. Radiation therapy uses high-energy rays to target and kill cancer cells. It can be used as a primary treatment or after surgery to destroy any remaining cancer cells. There are different types: external beam radiation and brachytherapy, internal radiation, each with its benefits and potential side effects like fatigue, urinary symptoms, or bowel issues. Number 4. Hormone therapy. Since prostate cancer growth is often fueled by testosterone, hormone therapy aims to reduce or block this hormone to slow cancer progression. Hormone therapy is usually reserved for advanced or recurrent prostate cancer and can be combined with other treatments. Number 5. Other treatments. Newer treatments, including immunotherapy and targeted therapies, are emerging, especially for advanced cases. Clinical trials might be an option for some patients. Choosing a treatment isn't just about medical facts. It's about your values, your lifestyle, and your goals. Some men prioritize preserving quality of life and avoid aggressive treatment when possible. Others want to be as proactive as possible, accepting potential side effects for a chance at cure. Whatever path you choose, open communication with your healthcare team is vital. Ask questions, seek second opinions, and involve your loved ones in the decision-making process. Prostate cancer may feel overwhelming, but you are not powerless. With knowledge and support, you can navigate this journey with confidence and hope. Now that you understand what prostate cancer is, the symptoms to watch for, your personal risk factors, screening options, and treatment paths, it's time for the most important part: taking action. Knowledge is powerful, but it only works when it leads to action. If you're a man over 60, or if you have risk factors like family history or are African American, schedule a conversation with your doctor about prostate cancer screening. Don't wait for symptoms to appear. Early detection is the key to better outcomes. Pay attention to even subtle changes in your urinary habits or unexplained pains. When in doubt, talk to a healthcare professional. Your body knows more than you think. While some risk factors can't be changed, others are in your control. Eat a balanced diet rich in fruits, vegetables, and healthy fats. Stay active with regular exercise. Maintain a healthy weight. Avoid smoking and limit alcohol. Manage stress and prioritize sleep. These habits not only support prostate health, but improve your overall quality of life. Facing cancer or the fear of it can be isolating. Surround yourself with family, friends, or support groups who can offer encouragement and understanding. Medicine is always evolving. New screening methods, treatments, and research continue to improve outcomes. Stay informed and stay engaged in your healthcare decisions. Remember, prostate cancer may be common, but it's not invincible. Early detection, informed choices, and proactive health habits give you the best chance to live a long, healthy life. You have the power to take control. Don't wait. Start today. So what does this all mean for you? If you're a man over 60, here's the bottom line. Your risk is real, and it increases with time. But knowing your risk isn't about fear. It's about power. The power to act, to get screened, and to make lifestyle changes that can protect you. In our next section, we'll talk about those screenings, the tests you need to know about, when to get them, and how to interpret the results. Because knowledge is your best defense against this silent killer.